Welcome everyone. My name is Ainsley and I am a counselor at Alzheimer Group Incorporated. AGI is a charitable organization that supports families and individuals living with dementia. We provide therapeutic activities, counseling, and support groups for people living with dementia and caregivers, as well as courses, workshops, and webinars to professionals and families. Our education initiatives are made possible by the generous support of the Lasner Learning Center and the Lindsay Memorial Foundation. Karin Derouaux has been with Alzheimer Group Incorporated since 2007. Working as an art therapist in the not-for-profit organizations Morty Gross and Busner Family Activity Center, she gained vital experience caring for individuals diagnosed with dementia. Now, as Director of Support Services, she shares her expert knowledge about the disease, counseling and educating caregivers in the public. Karin holds degrees in psychology, sociology, and creative arts therapy. Welcome, Karin.
Thank you. All right. So today we're going to talk about the transition to a residence, which is a huge transition for many, many people living with dementia and their families. So let me get my slideshow up here. All right. So, there are a lot of transitions when we're a person living with dementia, but one of the biggest ones is when it's time to move into a residence. And it can be tough to decide when it's time, where to go, how to explain it to the person, how to help them transition in as least stressful a way as possible. So we're going to talk about all of those things. Before I get to that, I just want to say that it is natural and it's normal if this feels difficult, if it feels sad, if the person living with dementia feels sad or upset or anxious or any of those things. Transitions just come with those emotions. And while we want to try and mitigate the negative things as much as possible, sometimes we have to go into a transition like this, just accepting the fact that maybe it's going to be a little bit stressful. It's not going to be the easiest time. Okay? And just because it's hard doesn't mean it's not the right thing to do. Okay? So, the plan for today, we're going to talk about making the decision. When is it time for a move? How are we going to broach the topic, and how are we going to choose the facility, okay? Then we're going to talk about what we need to do before the move happens. So communicating with the person and including them in the process to the degree that they're able to be included. How, what, and when to pack. Supporting loss and grief and managing your own stress. We're going to talk about the day of the move itself because it's a big day. We're going to talk about the logistics of moving day. We're going to talk about emotional support for everyone involved, the caregiver, the person living with dementia, anybody who got involved to be the muscle for the day, whatever is going on. We're going to talk about supporting everyone emotionally. And then we're going to talk about after the move. So we're going to talk about something called relocation stress syndrome, which is very common for people living with dementia. We're going to talk about, for if you're a family caregiver, what the shift in your role might look and feel like. We're going to talk about caregiver frustration, loneliness, guilt, all of those feelings that you might feel after the day of the move as well. Okay, so today's program is about making the transition to living in a residence as positive and as low stress as possible, not just for the person living with dementia, but also for the caregivers who are involved. But again, lowering the stress doesn't mean no stress because we have to have realistic expectations, right? And moving is stressful no matter what stage of life you're at. And of course, it's going to be even more stressful if you're someone who has limited insight into why you need to move. Okay? All right. So let's talk about the decision. How do we decide that it's time for a change in the living situation? Listen, the vast majority of people, when a person that they care about, that they love, is first diagnosed, will at some point consider the idea that, well, I'm just never going to have to move this person to residence. I'm going to take care of them at home. And that's worthy, and it's wonderful, and it's lovely. And it comes from a place of good impulse. But sometimes it's just not realistic. And that isn't necessarily the fault of the caregiver or a lack of dedication to caring for the person that you love. The reality is sometimes the resources that you have at home are just not enough to manage the situation. Sometimes the person is just not doing well in the home situation. There's all kinds of reasons why people need to move. And rarely is it happening because the caregiver just doesn't care enough to do the work to do the caregiving. Okay. The reality is this is a really difficult disease, and it's not possible to be a sole caregiver throughout the entire course of the disease. People living with dementia need a team of caregivers surrounding them. So if you're fortunate enough to be able to create that team in your home environment, wonderful. But most people are not able to do that all the way through the course of the disease. All right, so what are the factors that goes into it? Because the decision is not easy and it's not straightforward. I wish that it was. I wish that I could say, well, there's just this day where you wake up and you know that it's time, but it doesn't really work that way, right? Every situation is different. The factors involved and the factors at play are different for each individual person. And we have to consider a whole bunch of different things and how it's working for you as a family in particular before we make a decision about whether or not it's time for a move. So we're going to look at factors that impact the person. So maybe the person has physical changes. Maybe the person is living in a home with stairs and can't do the stairs anymore, or can't get into the bathtub because they need a walk-in shower and it's not possible to renovate the bathroom. Or maybe the person has physical changes that keep them up all night long, and so they need to be supervised both day and night. Maybe the person has medical conditions going on that are making it more difficult. Maybe the person has maybe the person is in a wheelchair or can't do transfers from the wheelchair to the bed anymore. I mean, there's a million different physical changes that could be contributors to the decision to make a move, and they're valid, right? Some people need more of a healthcare environment in order for their physical care needs to be met. And so that may be one of the factors in deciding that it's time for a move. The person's emotional life may also be a factor. So, for example, somebody who's living at home who may not have the option to move in with a family member, which is valid. If that person is getting anxious at home, getting confused at home, not able to manage on an emotional level the day-to-day things, that can be really an issue. We're very often focused on whether or not a person living at home alone has a safety issue. So are they leaving pots on the stove and not turning them off? Have they had a fall? Have they wandered and gotten lost? Are they eating spoiled food? All of those things fall under what I would call symptoms and reactions to the symptoms, where you're just losing cognition and making mistakes that are dangerous. That also falls under ADL, so activities of daily living. Are you managing them and managing them safely? Those are really, really legitimate factors in deciding whether or not it's time for a person to move. But also, the person's emotional life is a factor, because if a person is not doing anything dangerous, but they're afraid to answer the door, or they're afraid to go out of the house, or they're just feeling generally nervous on their own and they have nowhere to go to with their worries or their problems or their confusion, that's a quality of life issue, and we need to address that. So we don't just want to focus on physical changes and symptoms and reactions. There's a few things that we often ask people, like, have they had an accident? Have they had near misses? Have they had a fall? Would they remember how to call somebody for help? Would they be able to call 911? And if they did remember to call 911, would they have the verbal skills to explain what problem is happening? All of those are Very, very valid reasons to consider a change in living situation. But so is emotional well-being. So we want to put that in the picture. Okay. We also want to talk about caregivers. So it's not just the well-being of the person living with dementia who has to be considered in making the decision. We also need to evaluate, if you're a caregiver listening, well, what's your quality of life like? Are you safe? Are you feeling emotionally okay? Right? Um, so, what's your emotional life like? Are you a ball of nerves all the time? Are you always getting angry, irritable? Are you always feeling exhausted? Are you feeling depressed? Right? What's your physical ability? Do you have the physical ability to actually meet the care needs of the person that you're caring for? If that person is up all night, are you able to tolerate the lack of sleep and find places to get that sleep in, because your need to sleep is not going to go anywhere, right? If that person needs assistance with transfers, do you have the physical strength to be able to do that? Okay. Um, do you have the ability to really understand what's going on with the person and to respond appropriately? You know, I hope that all of our counselors are having, or all of our caregivers are having regular meetings with our counselors, but not everybody, for many, many, many reasons, is able to put into practice the things that we're teaching. And are you coping well? Are you finding the time to engage in self-care? Okay. So finally, we also want to look at what the family's resources are, because if we're evaluating the person living with dementia and the caregiver in all of those ways, and we're finding that some areas are lacking, well, that means that some kind of change needs to happen. It doesn't necessarily mean that change has to be a move. At that point, we're going to look at things like resources. Okay. So what are your financial resources? Can you hire help? Can you renovate? Can you make sure that you have the things that you need in order to manage the care of the person without you burning out and without the person being in physical or emotional risk? Okay, so we're looking at financial resources. We're looking at environmental resources, because sometimes you could have all the money in the world. Let's say you're living in a very small condominium and you have lots of money. You have enough money that you could hire 24-hour care. The person living with dementia is staying up all night and is disrupting your sleep. Well, sometimes, no matter how much money you have to pay for care, maybe your small apartment is just not the best place for you to be with the person, because no matter how much care you have, no matter how much accompaniment you have, that person is still going to disrupt your sleep every night. So we want to think about, well, do you have the resources to make sure that the environment you're in is appropriate, right? If you have the money, if you have the financial resources to renovate your bathroom, but what you need to install in the bathroom is just not possible where you live, well, maybe you need to consider a move, right? And the third thing in terms of resources is availability of additional care. It's hard to find care, and it's hard to find good care these days, right? And not every person living with dementia is going to accept every caregiver either. So we struggle to find caregivers, and sometimes we struggle to find a caregiver that's a match. Some people living with dementia actually do better, instead of having individual caregivers who they feel watched all the time and supervised all the time. Sometimes people actually do better in a residence environment where they don't have someone following them all the time. They have more freedom within the frame of the institution that they're living. So there's lots of different factors. It's why it's impossible for us to say, yes, it's time, and no, it's not time. But we need to look at all of those things, and we need to ask ourselves the question, is it realistic for me and my loved one and my family in the situation that we find ourselves right now? Is it realistic to continue the way we're continuing? All right, next page. So Once you've made the decision that no, it's not realistic the way we're going, we need to make a change of living situation, we're not going to jump right away necessarily into the option of moving a person into a residence. We're going to look at what the options are. So here are some of the options. Increasing care at home. So that can mean the caregiver continuing to live with the person living with dementia and bringing in caregivers for a few hours a week, a few hours a day, all day, and all night, depending on what's needed in terms of care. Okay. It could also mean the person living with dementia being the one to stay home and the caregiver being the one to leave. Doesn't happen very often, but I've seen it happen before, and it's an option, right? Another option could be the person living with dementia and the caregiver moving together into a more supportive environment. So, for example, a semi-autonomous residence where the person is not receiving full care, but the family caregiver who's the primary caregiver has a supportive environment in which they can get help as needed. There's the option of just the person living with dementia moving into a private residence, which tends to have, compared to, for example, a CHSLD, so a nursing home level of care in Quebec, tends to have a somewhat lower level of care, but different residences, private residences have different levels of care. Or there's the option of the person with dementia moving into a public residence, okay? So these, of course, have very widely variable costs associated with them. And, when you're making the decision of what increased care is going to look like for this person, we have to take finances into account. We live in the real world, right? So it's really important if you are at this point of making the decision of what kind of care environment that you're looking for. I often encourage people to do a little bit of research on all of the different options to see which one is feasible. All right. So, what to do if your family members disagree? Because, not every family is going to agree with every decision. Okay. I've worked with lots and lots of families, and, it's very possible that, different people in the family, all of whom have the absolute best intentions and want what's best for the person, don't see the situation in the same way. Okay? So, what do we do when family members disagree? Well, the first thing is we set aside judgment. Okay? We don't want to assume the person disagrees because they're trying to make your life harder or because they don't understand the situation. Sometimes that's the case, right? But we don't really come to consensus if we start from a place of judgment. So we assume that everybody every stakeholder in the family has the person's best interests at heart. Okay? So we start with setting aside judgment, and we start with talking not about the actual move and what the decision is. We start with talking about values. So very often disagreements start with different values. So, for example, one family member might say, to me, it's important that mom's autonomy comes before all else. She's always been independent, and she would rather be at risk and independent than in a supportive living environment and losing her autonomy. Another family member might say, it's really important to me that mom is safe. And it's more important to me that mom is safe than mom is independent. Are either of those things wrong? No, those are both really good values, right? Unfortunately, in a decision like this, those are values that are sometimes at odds with one another. But we start with talking about values because we're not sure, we can sometimes get hyper focused on the decision without seeing where the other person comes from. Okay, so we talk about values. We see if we can come to some consensus, some middle ground in terms of what value we're going to prioritize above the others. Okay, and when we can't do that, or when our values are not matching, the next thing we do is we ask the real and honest question, well, what are the diagnosed person's values? Is mom more risk averse or independence focused? In a situation like that, what would mom prioritize? because her values trump yours. And sometimes deciding that you're going to do what she would do if she had all of the information and could properly process it. So, mom of the past, what would mom have done in that situation? If mom was deciding for her mom, what would she be prioritizing? And very often, when we start to have that conversation on the values level, the decision becomes a little clearer. Okay. But sometimes it doesn't. Sometimes it takes a while. Consulting with a professional like a counselor at AGI can be really, really helpful, because sometimes you're just hyper focused on your perspective and you don't really understand what's going into the other person's perspective. And sometimes consulting with a professional will help you find a middle ground. Okay. And one thing that can be really, really helpful is to explore each other's solutions. I once worked with a couple of siblings, and I gave them the homework one day. They could not, for months, they were at odds about whether their parents should move into a private residence or a public residence, and they could not see eye to eye. And sometimes you think, well, why are they arguing about this? They're quibbling. But for them, it was a big deal, and they couldn't come to an agreement. One wanted a small public foster home, and one wanted a much bigger private residence with lots of activities and that kind of fancier environment. That's fine, right? And this happens all the time. I've had many, many families that are kind of starting out at odds like that, and what they vision for their parent in the future. So in this particular family, I sent them off to do homework. And their homework was each of them was supposed to go and visit what the other one had envisioned. They were supposed to get all of the information and give each other the respect of picturing their parent in the other environment than what they had envisioned. So they went off and did their explorations. They both did their homework. I give them full credit. They both came back 2 weeks later. They both flipped. So they still didn't agree, but they both wanted each other's. In the end, it got figured out, because it always gets figured out in the end. If the family is committed to talking and figuring it out and puzzling it through and being respectful and not judging each other and looking at values, it always eventually gets figured out. But it was quite funny, because they flipped perspectives completely, and then they were arguing for each other's perspective. What are you going to do? Right? So listen, families are hard, but I love it when families come in and everybody cares enough to have a perspective, and they're not just, checking out. All right. So you've come to a decision, some kind of decision, whether it was an easy one or whether it was a hard one. You've decided it's time for XYZ decision, and let's say you've decided that it's time for a move into a facility, whether that's a facility together, a private facility, or a public facility. Okay, so at this kind of point, it doesn't really matter. You're checking out facilities now. You've decided that you're not just going to increase the care at home. The person living with dementia is moving into another environment that's more supportive, with or without you. Okay, so what do? How do we choose a facility? Well, the step one, go see a financial advisor, because it's not unusual to discover that you have more ability for more options than you think you do. Okay, so that, and we want to be looking long term. If this person goes into this, this kind of facility for this long, how much money do we have? At what point do we have to move into this other kind of facility that's less costly, or whatever? Like, you really want to know, well, what are your financial resources here? Okay. You want to have a checklist of what's important to you when choosing a facility. Now, no, you can change your checklist anytime. Okay. No facility is going to meet every item on your checklist. So you want to have your checklist, and you want to know which things you're able to supplement in terms of the care, and which things are absolute deal breakers for you. So you're going to make a checklist, and you're going to prioritize it. Okay. You're going to set priorities of what are the most important things on your checklist, what are the least important things on your checklist, not because they're not important things, but because those are things that you could find ways to supplement outside of the facility. Okay? Next, you're going to consult with either your social worker if you're looking for a public facility, or with a placement counselor if you're looking for a private facility. I'm going to explain in a minute what a placement counselor is, okay? But a social worker through the CLSC is your access point to public facilities. And really, they will tell you what level of care the person is eligible for, and they will tell you which residences they recommend. You should know, however, that you have the right to choose any facility anywhere in Quebec. Now, that doesn't mean there'll be a bed. And very often they'll encourage you to take a transition bed if they think the wait is going to be very long to find a bed in the residence of your choice. But know that you do have the right to tell the social worker, the public in the CLSC, the public social worker, which your top facilities are. I suggest you have 2 or 3 on your list, okay? Because if you just choose one, you may be waiting longer, okay? A placement consultant is somebody who's basically a real estate agent for somebody who's moving into a private facility, okay? So placement consultants are for-profit business. They're running a for-profit business, but you don't pay for them, okay? So they get paid by the residents when you sign a lease. I tell you that because, one, going into it, it's important to know that, yes, they do get paid, and they get paid by the residents, right? But 2, you should also know that you don't have to pay the placement consultant. So if anybody's asking you as a person looking for a facility for money in order to help you find one, then something's not right, okay? Because you don't pay the placement consultant, the residents pays the placement consultant. And since it's free to you, why not? Why not use them, right? Their job is to narrow down the field for you based on that checklist and those priorities that you have set. Now, just like any other field, there are people who are really, really good at it and people who are not really good at it. So you can, if you consult with a placement counselor and you're not happy with the service you're getting, and where they're suggesting to is not actually meeting what your priorities are, well, then try a different one. Okay, just like a real estate agent. Okay, some people are going to get you and some people aren't, but it can be a really, really valuable service because otherwise it can be really overwhelming, right? So you really want to think about consulting with somebody who can narrow down that field for you so you're not too overwhelmed. Okay, so once that's happened, you want to start visiting places, and you can decide how many places you want to visit in order to feel like you've got a really good sense of what the options are out there. Okay. Now, I will say, in my experience, and I've been doing this a long time, if you've never been to a residence before, if you've never spent time in a residence before, you're probably going to hate the first one you visit. Okay. So maybe don't go to the most likely one first. Okay. Because most people, it's kind of a different world, and it can be kind of a shock to the system to imagine your loved one at whatever residence you go to. There's lots of people there who might not be as well as you're used to being around. There might be smells, there might be machinery, there might be, I don't know, all kinds of different things, right? Different people react to different things. You get used to these things. They become familiar, okay? So just remember, if you freak out the first visit and think the place is horrible, maybe go back and visit it again at the end because you might see it in a different light, okay? When you're there, ask tons of questions, especially when you're visiting private residences. They tend to have marketing people that take you on a tour. Go ahead and ask any questions that they don't have to be on-script questions. You can ask any question you want. In fact, we encourage you to take a list of questions with you and ask the same questions at various different facilities. And if you need help with a list of questions, your AGI counselor got lots of resources for you there. Okay? We encourage you to bring a trusted friend with you because it can be overwhelming and you don't necessarily hear all of the, or retain all of the answers. And if you're visiting 3 or 4, excuse me, the answers to the questions you think you're going to remember, but you get to a point where it's kind of hard to remember which one said what. So bring a friend and ask that friend to take notes for you. Okay, that way you can pay attention, you can look around, you can see what you need to see, right? But the person that you bring with you, they're going to be taking the notes for you so that you don't forget what you saw. Okay. And when you're getting a tour of a residence, pay attention not just to the things that the person giving you the tour is drawing your attention to, but look around. Chat with the people that you see. Okay. Ask questions. If there's a person living with dementia who chats with you, chat with them. Get a sense. You don't have to ask them all the details about their life in the residence, but you get a sense of, how the person is feeling being there. Not everybody is going to be a happy camper all of the time. We're all human beings. We have good days and bad. But if you have an opportunity to talk to a caregiver who might be visiting, ask them what their experience has been. Pay attention to what's happening around you. So, is there an activity going on? Are the people who are attending the activity actually participating in the activity? Are people who are mobility compromised, are they brought to the activity? Like, have they made it there? Or is it only people who get there under their own steam? What's the staff doing? Is the staff all at the nursing station or on their phones or talking with each other, or are they interacting with the people who are living there? Okay. And apart from that first visit where you might be freaking out a little bit, as long as you're calm, as long as you're keeping your cool, trust your gut. Okay. You know your person living with dementia better than anybody else, and you know where they're going to feel at home and where they're not. Okay. So trust your gut, trust your instincts. They're usually right. Okay. All right. Step 3. You start from all the places you visit, and you narrowed it down with the placement consultant. You visited, you're going to narrow it down again to 1 or 2 residences. I don't recommend more than that. Okay. Once you've narrowed it down, let's say you've narrowed it down to 2 residences, then it's okay to visit with a person living with dementia. You don't want to have the person living with dementia involved in 10 different visits. It's just too overwhelming and stressful, and the person is not going to remember all of the details, right? If you've narrowed it down to 1, fantastic. Then the person, you're asking their reaction, and they're getting a yes. You're getting a yes or no reaction. But remember, just like you might have a negative reaction to that first visit to a residence, so might they. So if you've got your heart set on one residence, well, maybe that's not the first one you visit, okay, of the 2, okay? And once you've visited with the person, ideally, see if you can have a meal there, or if you can join an activity that's there, so that the person diagnosed with dementia isn't just there being asked questions and being put on the spot, okay? Once you've done that, then it's time to make the decision about which residence it's going to be, okay? You don't want to draw it out for too long. Once you've involved the person living with dementia, the reality is you're going to have to make the decision sooner rather than later, okay? Because if you draw it on too long, you're going to have to start all over again. All right. So how are we going to broach the topic, okay? Well, this is one of the questions I get asked the most. I know it's time for the person to move, but they're going to freak out. So the first thing I want to say is, yeah, they might freak out. If you told me I had to move out of my house and I didn't have a choice, I'd probably freak out too. I really like my house and I don't really want to leave. If you told me I was leaving, I'd be pretty upset, and I would have the right to have those feelings. They're perfectly valid. You would probably feel the same way too, right? So the first thing you want to do is let the person feel their feelings, right? But when you talk about the move, okay, when you state your case for the move, a trap that people often fall into is what I call the negative approach. So, I know it's awful to have to move from your home, but it's really time because you forget and you make mistakes and you do dangerous things and you're keeping me up all night and I just can't take it anymore. And all of these negative things that are all true and all valid and all contributing to your decision that it's time to move, but is not going to do anything but get you pushback in most cases. And the reason you're going to get pushback is because a person living with dementia is very likely not to remember that any of these things are happening. And so sometimes people feel really gaslit, right? Like, you're telling me I left the stove on and I never let the stove on. Why are you doing this to me, right? So we want to make sure that we are not focusing on, having moving into a residence be because of some sort of failure on the person living with dementia's part. We want to flip that around. We want to focus on the move to a residence being something that will contribute positively to the person's quality of life. So if it's not positive, it's not one of the arguments for moving. Okay? And that's really hard because often you're making this decision and you're breaching this topic at a point when you're exhausted and you're down and you're burning out and you can't see anything positive. You just want to stop the negative, right? It's not a great way to encourage somebody to move, though. Okay. So what does the positive approach look like? Well, you're going to pick your moment. You're going to pick a moment when the person feels connected and bonded with you. You're not going to do it in the moment where the person is driving you crazy and you're like, enough is enough, you have to move. Because that's making the move into a punishment. And we're not moving the person to punish them. Okay? So you're going to make sure it's in a moment where you've got a really good rapport established. Okay? You're going to base your explanations on what the person knows and not what's missing, okay? So I want you to think about everything a person knows about their life, about their experiences, about their memories, about their health, all of that. It's like a big puzzle in your brain, okay? Most of us have most of the pieces of the puzzle, so we have what we call the big picture, right? When you have dementia, you're losing more and more pieces of the puzzle. So maybe you don't remember your dementia diagnosis, or you don't know that you forget. You can't remember the mistakes that you made. You have no idea that you have kept your loved one up every night for the last 3 months, okay? If you don't have that insight, those pieces of the puzzles are missing, then the big picture is missing. But most people have some kind of insight into some things. For example, a person living alone might know that they get anxious and lonely, right? Or a person might remember that they fell, or that the doctor said that they needed, insulin every day, and that they forget sometimes. There's many things that people do know. It's going to vary from one individual to the other. But when you're talking about why a person is moving, you're talking about the benefits, not the deficits, but you're only talking about the things that actually speak to the person because they relate to what they remember. So you were sick, last month. You had to go to the hospital because you forgot to take your insulin, and that's okay, because guess what? This place, they're amazing. They give you your insulin every day, and that way you never have to go to the hospital again for that, right? The person's been really lonely and you want to focus on, wouldn't it be great if you lived somewhere where just outside your door there were people to talk to any day, any night, anytime you need it, there was somebody there to be with you. You don't have to be with them all the time, but anytime you want to talk to somebody, there's somebody there to talk to you. Okay? So we're focusing on how the person is going to benefit, not on the deficits that are making the move happen. Okay? We want to kick it slow, and we want to validate emotional expression. So what I mean is, we don't need the person to agree the first time we talk about it. We don't need the person to immediately be like, I think that's a wonderful idea. The person might say, I hate that idea. I don't want to leave my house. And we might just want to reply with, you don't want to leave your house. I get it. I probably wouldn't want to leave my house either. It's really scary. It feels like home here. I can't imagine another place feeling like home. That's a valid way to feel. Let's keep talking about it. Let's talk about what you need to make it feel like home. Okay? We want to encourage the person to take an active role in the process to the level of their ability. Okay? So sometimes, I have people who say, well, I understand it's important for the person to take an active role in the process, but they refuse. And I'll say, well, how do they refuse? And they'll say, well, I told them to pack up their closet and they won't do it. Maybe they can't pack up their closet. That's too big a job. Maybe they need to be with you, and you ask them, take that item of clothing off the hanger. I'm going to fold it and put it in the box, or whatever you need to do. Okay. Maybe that task is too emotionally taxing. Maybe that's too anxiety provoking. Maybe their level of involvement is going to be something different, like going the day before and sweeping the floor of the place. I don't know. You're going to figure out what the person can handle both physically, cognitively, and emotionally, and you're going to let them be part of the process, but only to the point that it benefits them. We're not trying to get work out of the person. We're trying to get buy-in and involvement and motivation. Right? And one way to get that is to include the person in the process, so it's something that they're doing with you and that you're not just doing to them. Okay? And we want to take concerns seriously and answer questions repetitively. And that's really hard. But it is perfectly normal for a person with memory loss who's approaching a really big life transition to ask the same question over and over and over again. Because I would. If I couldn't remember the answer, but I remembered some big thing is happening, I would be asking all the details all the time. And we just have to kind of take a deep breath and remember that, of course, they're asking repetitive questions. They should be asking repetitive questions. It means that they're trying to understand what's going on and grasp it and anticipate it, right? And we want to take their concerns seriously. Maybe the person is concerned that, I don't know, it's going to be really noisy. And you want to go to the residents, you want to say, listen, what can we do to mitigate the noise? My parent is really worried about that, or my spouse is really worried about that, or whatever the concerns are, right? How am I going to find my room? Well, let's think about it. What could we do? Could we decorate your door? What should we put on it, right? We want to take concerns seriously because the concerns are really valid, right? What's going to happen to my cat? What are we going to do with all the stuff I can't bring with me? Right? All of those things are really valid, and we want to take those concerns seriously, and we want to help them know that we have a plan. Okay? Sometimes the things that the person is concerned about are the things that we think aren't important, but it's not for us to decide what's important or not to another person. Okay? All right. So let's talk about packing. Okay? How to pack, when to pack, and what to pack. Okay? So, how to pack. We're going to focus on what's coming to the residents and not what's not coming. Okay? So, it's very easy to just say we have to go through everything in this house and get rid of it. Okay? Ideally, wherever the person's living, their house, an apartment, a condo, in an ideal world, you'll have at least a couple of weeks after the move to pack up anything that the person didn't take with them. Okay? So you don't, before the move, have to worry about packing everything. You just have to worry about what's coming. Okay? Now know that you should have some things prepared, or at least a very quick list, your quick list of things that can get packed up to go quickly. Because if you're moving the person into a public residence, you'll have 24 to 48 hours to move. Okay? You'll get the call that there's a bed. You have to accept it right away, and you have to have that person in the bed very quickly. So you want to plan for that ahead of time, right? You want to have a list of, well, what are we bringing? Do you have to bring everything that's going with the person to the residence? No, you have to get the person in the residence, not all their stuff. However, you know that there's going to be some things that they need to have right away, and you want to get those things. You want to get yourself organized so you can get those things ready right away. Have boxes waiting so that they're ready for you to put them. So the day you get the call, you don't have to go to wherever and find boxes, right? You want to include the person into making choices if the person is emotionally able to do that. Okay. You want to respect their capacity and their stamina. They're not going to be involved in every tiny little decision and every moment of the packing process. You can consider getting help. Many placement consultants also have people that will help you with the actual move. And one of the things that can really help, because listen, most residences are much smaller than wherever the person was living before. You cannot take everything. And while it's nice to say you're going to take everything of meaning, the truth is that sometimes there's a lifetime of things built up, all of which have meaning, and you can't take it all, right? So when there's something that can't come, I often suggest taking photos of that thing and creating an album of photographs of just objects that have some meaning for one reason or another, but that couldn't go with the person. Because those photographs are actually a wonderful reminiscence tool to help keep the person in touch with their identity, with their life experience, with the people that they love and care about, with the things that they've done, right? So take lots of photos during the packing process, especially of the things that can't come, okay? So when do we pack? Well, not too far in advance, okay? The earlier you start, very likely the earlier you're going to start to see some anxiety and some confusion, okay? So you don't want to do it too far in advance, but at the same time, you don't want to do it in a complete panic either. So you're going to find that balance, okay? If possible, pack up what's not going after the moving day, okay? So that the person doesn't have to watch you pack up all their other stuff and dispose of it, okay? And things that are kind of a gray area that you don't know if the person is going to want or need, consider storing it for a few months, okay? That way, if the person says, I don't know, where's my red coat? And you had decided the red coat wasn't coming, you can go find that red coat and bring it to them. I know it's not always possible to store items for a few months, but it can really save you. I also recommend doing that if you're getting rid of something that belongs to the person, like let's say you're getting rid of like some old clothes that don't fit them anymore, take them away, but don't dispose of them until you're sure that the person isn't going to ask for them again. Because once things are donated, or whatever you're doing with it, and you can't get it back, it can become a real stress, okay? So, what to bring? New is not always better. Bring things that will feel familiar. So you want to look at around the person's living space, and you want to think, what are the things this person sees on a day-to-day basis that makes this place feel home? Do they have a blanket on their couch? What's the cover on their bed? Do they have art on the wall that they look at on a regular basis because it's there, it's in their field of vision, okay? You want to make sure that you're bringing at least some of that stuff because that's the stuff that's going to make the new place feel like home, okay? You want to consider the person's senses. So what will they see, hear, feel, taste, touch, and smell, okay? What things are familiar? What things are comforting? What things feel like them, feel like their home place, okay? What you want is as much as possible to help the new place feel on some level like the old place. You're never going to get 100% there, right? But you really want that person's environment to reflect how they have lived before, okay? All right. So if you're packing and the person living with dementia is involved in the packing process, you want to make sure that you're supporting them, that you're validating them. You want to give them your full attention. You want to let the person express. You want to get curious about why they're feeling how they're feeling or why they're emotionally attached to a particular thing. You want to acknowledge, reflect, and accept. The moments of packing that the person living with dementia is involved in, the goal is not packing. The goal is supporting and validating. If you just want to get it done, do it at a time where the person is out of the house involved in another activity. Then you can just be as task focused as you want. But while the person is involved in the packing, it's not really about putting the stuff in the box. It's about supporting and validating them. All right. Let's talk about moving day. What are the logistics? You want to get help? You want to assign clear roles? You want to have one person fully focused on the needs of the person and maybe a couple of others that are fully focused on setting things up. You want to have somebody who's responsible for the decorating and making it look as much like a familiar place as possible. You know, you want to have somebody who's in charge of making sure that there's food, making sure that, you know, you want to have somebody who's the timekeeper to make sure that you're taking breaks regularly, because hungry and tired people get cranky. And that's the case not just for the person living with dementia, that's also the case for everybody that's helping with the move. So as much as you want to get things done, you're going to get more things done if you stop and take breaks periodically and if you make sure that you're eating regularly, because all kinds of negativity and conflict are going to come up if people are hungry and tired. Okay. You want to set on moving day, you want to set things up as much as possible before so that the first time the person walks into the room, there's something familiar there. It feels good. Okay. Or some kind of lovely surprise or whatever it is you think that will help the person kind of feel delighted with their new space, if that's at all possible. Okay. You want to keep decisions and tasks for the person who's diagnosed as easy and straightforward as possible that day. So think yes, no, not choose between 5 things. Okay. And you want to consult with the staff beforehand to learn how they can help support the person, especially that moment where you have to leave. Okay. So, how are you going to support the person emotionally? You're going to make sure that there's somebody there that day who's only focused on their needs. Okay. So, while other people are packing and unpacking and moving and setting up and decorating and whatever, you want somebody who's not involved in any of those tasks. They're just there to focus on the needs of the person living with dementia. You want to listen without judgment or challenge, because it's going to be a tough day. Okay. You're going to accept all emotions that come, even the not so pleasant ones. You're going to ask the facility staff for assistance, especially when it's time to go. Okay. You're going to make sure the person is being engaged by staff or in an activity when it's time for you to leave. Okay. That just makes that moment of departure a little bit easier. All right. How are you going to support yourself as a caregiver or the other caregivers that you're doing this with? Okay. You're going to remind yourself that it's a tough day and it's okay to feel guilty, sad, irritated, anxious. And honestly, it's okay to feel relieved. It's okay to feel like, oh, I'm getting my freedom back. Okay. All of those feelings are fine. There are no bad feelings. Okay. It's really important for most people. Obviously, everybody's different. But if you can have a friend accompany you after you leave so that you're not alone, especially if you've just moved your spouse into a residence, it's really hard to go home to an empty house, right? So if you can have somebody with you after you leave, it can really ease that transition for you. Plan your evening ahead of time. Remember, you're going to be tired, but plan something so that you're not going home to an empty house. And freak out if you need to, because sometimes you need to, but don't do it in front of the person. Okay? All right. Let's talk about after the move. So first we're going to talk about something called relocation stress syndrome. Okay? Relocation stress syndrome is a nursing diagnosis that's characterized by symptoms such as anxiety, confusion, hopelessness, and loneliness. It usually occurs in older adults shortly after moving from a private home to a nursing home or assisted living facility. Okay? Well, no duh. Lots of us get a little stressed and a little anxious and a little upset after we've moved, right? It's very normal. It's very typical, but we want to remember that people living with dementia may have a hard time managing those emotions because of the symptoms of their disease. Okay, so relocation stress syndrome, in a very significant way, is more likely to happen when there are some risk factors. So a recent history of losses. So let's say the person lost their primary caregiver, the person passed away, right? But listen, let's be honest. Everybody living with dementia, if they're at the point of having to move into a residence, has already experienced many different losses, cognitive, physical, emotional, interactional, right? Another risk factor is lack of adequate support. So not having people who are there to validate and accept how you're feeling, okay, without trying to talk you out of your feelings. A lack of preparation is a risk factor. So when it happens like that and you've never heard anything about it, and listen, the reality is sometimes that happens because you may have talked to the person about it, but they just don't remember what you talked about before, and we can't necessarily get around that, right? The degree of environment change. So how different is it from where you were living before? So for example, moving from a private residence into a public residence is easier from moving from a home environment into a public residence because the degree of environmental change is bigger in that. And a history of previous transfers. So if you're somebody who's been moved 6 times, well, each relocation is going to add to your stress, right? All right. So what do we do? Well, after moving, the person living with dementia is going to need to learn their place in the new facility. They're going to need to adjust to new and unfamiliar routines, cope with strangers and sick people in their environment, and trust the staff won't harm them. And the first thing we need to do is recognize that it takes some time. This doesn't happen overnight. And it takes longer than it would take for us. For those of us who have neurotypical brains who can remember things more easily, we need to help these things work into the person's long-term memory. So this is a point where we really do need to rely on our patients and rely on our knowledge that the person needs time to adjust in all of these ways. Okay? So what does adjustment look like? Well, adjustment could be all kinds of different things, right? It could be the person being calm, eating all of their meals, accepting help from the staff. It could be participating in activities. It could be making a friend or making more than one friend in the residence. There could be all kinds of different things that adjustment looks like. Adjustment looks different for different people, okay? Sometimes it can help to think back to, well, how did the person behave when they were at their best in the past? And is adjustment sort of starting to look like that? What adjustment doesn't look like is a person never gets upset or never gets anxious, okay? I don't know about you, but I get upset and I get anxious. I get upset and anxious on a fairly regular basis because I'm a human being and I have emotions and I have all kinds of different emotions. So as much as we want to make people happy, being happy all the time is an unrealistic measure of adjustment, okay? What we want to know is the person is doing okay most of the time. They're feeling content a lot of the time, okay? So how can families help with relocation stress syndrome? One, you want to talk with the head nurse or the social worker in the facility to find out what support the facility can offer. You want to visit often, and importantly, you want to visit predictably to provide a sense of security. So I'm not saying you don't spot check with the residents and you show up different and unexpected time once in a while, but you want the person living with dementia to be able to predict that, my loved one comes every day at 4 o'clock, or my loved one comes right after supper, or my loved one comes first thing in the morning and has breakfast with me, or whatever it is. You want to be predictable. Or my loved one comes every second day at the same time or once a week at the same time. I don't know what your predictable is going to look like, okay? But you want to be predictable enough to provide a sense of security. When you come, it's really nice, especially if the person is a little angry with you, to bring familiar items and food. I like to think of it as you're going to be the purveyor of the good stuff. You're going to bring with you things that the person might be missing from home, okay? When you're visiting, you want to help the person make connections with staff and other residences. We have a tendency to kind of go into our little bubble when we visit, so it's just you and the other person, right? And sometimes we even feel like when staff or other residents are trying to be part of our interaction, sometimes we feel almost like, go away, I want to spend this time with my loved one. But actually, it's an opportunity So if you're interrupted by another resident and you have an opportunity to make a positive interaction with that resident, well, your loved one is going to start associating that other person with that positive interaction with you, and they're more likely to be open to kindling friendships as well. Okay? We want to encourage involvement in the community activities, and that might mean you joining in on some of them too, right? When you're visiting, you don't want to focus on the past or the future. You want to focus on the here and now, right? You want to focus on the benefits of being there, not the deficits, the same old story as when we were broaching the topic. Validate, validate, validate means whatever the person is feeling is fine with you. You're going to acknowledge it, and you're not going to try and talk them out of it, and you're going to give them lots of time to adjust. Okay? All right. Let's talk about your new role as the primary caregiver. Okay, if that's what you are right now. Okay, so your role is not gone. You are not no longer a caregiver, but you have shifted for the most part, probably not entirely, but to some degree, you're shifting your role from the hands-on care provider to being the care manager. And care management is crucial for the outcome for your person living with dementia. Okay, this is not a point where you're warehousing a person and walking away. You are there to make sure that the care that they're getting is the care that they need to be getting. Okay, and when things are not, if things are lacking, you're going to make sure that you find ways to supplement. Okay, so one thing you're going to do in the care management role is you're going to ask the facility, what is the best way to communicate concerns with the staff? When you communicate, you're going to communicate it in a way that's respectful, that recognizes that you're all on the same team, but also you're not going to be afraid to give feedback or ask questions or make suggestions. Okay? There's a wonderful book about complaints if you get to the point to having to make complaints. It's by Amy Fish, and I think it's called The Art of Complaining Effectively. We have a couple copies in the office if anybody wants to come by and borrow them. It's out of print, so it's hard to get it elsewhere. Okay? You want to also recognize that as you take on this new role of care manager, it's a really important role, but because you're not providing as much hands-on care during your visits, you get to also go back to being your loved one's husband or wife or son or daughter or friend, right? You get to go back to having a non-caregiving role all of the time, okay? As the care manager, you want to make sure that everybody who's concerned has the opportunity to get information. So you want to encourage family meetings. And you also want to seek support because you're learning how to navigate in a new facility. And you want to make sure that you have a network of other people who have done this before, because sometimes it's hard to know what you can and cannot ask for. Okay, so it's important to seek support. AGI support groups are really good for that. Okay. All right. Let's talk about how you might feel. Okay. A lot of caregivers after the move, especially if they were living with the person before, feel a lot of loneliness and especially a lot of guilt. Okay. So recognize that your feelings are normal, and so is relief. Okay. And ask yourself, how do those feelings serve you? Because let's be honest, all feelings can push you towards the things that you need. Okay, so if you're feeling lonely, well, maybe that's because you don't have enough social support and you need to work on that. And the good news is you probably have time now, right? If you're feeling really guilty, remember that guilt is a way that makes sure that you go back even when things aren't going super well. So if the person's really upset with you and you don't want to go back, well, your guilt might be the thing. Some days it might be the thing that gets you to walk through the door. And that's a good thing, right? You know, if the person is experiencing relocation stress syndrome, if the person is upset, if they're agitated, if they're anxious, if they're angry, all of those things, remember, you're not working towards perfection. You're working towards good enough. And I often say, before you decide if something is going well or if it's a disaster, if the move is going well or it's a disaster, give it 3 months, right? Because it takes time to adjust. So remember, we're looking in 3 months, not for perfection, we're looking for progress. The person is getting upset less, they're less isolated, they're crying less, or they're right. You're getting less reports that the person got upset or agitated or they needed less medication, whatever it is. We're looking for progress. We're not looking for perfection because none of us are perfect. And we're not going to suddenly be perfect just because we have dementia, right? You want to give some thought to what your needs are in your routine. It's not uncommon by the time you get to the point of moving the person into a residence that you have not been thinking about your needs and your routine for quite some time. All been about the person living with dementia. So you might need to make a plan to put you back in your life, and you might need to get some counseling. Okay. All right. So thank you very much. That's the end of my presentation. You'll be able to find this one and a whole bunch of other recorded webinars on our YouTube channel. For more information, to talk to a counselor, you can give us a call or send us an email at AGI. Okay. I'm going to stop the share, and then Ainsley, you can let me know if there's any questions that were sent in.
Yes, perfect. Thank you so much, Karin. So you actually answered a lot of the questions that were sent in by email, but there is one
Yay!
that came forth. So
Okay.
I will share this one for you and we'll see what we can do. So the question was, what if you are a senior without family or friends? What do we have to
Mm,
know about a move before memory issues become severe and
right.
after?
Okay, so that's actually a really, really good question because the reality is when it's time for a move, you might not have the insight to know it's time for a move. And that's just unfortunately the truth. So, a couple of things I would do in a situation like that. And I'm putting myself in your shoes. If this was me, one thing I would do would be to make sure I was making a connection with somebody who is brave enough to tell me if they're worried that I shouldn't be home anymore on my own. Okay. A good person to do that is a counselor at AGI, especially if it's somebody that you've been talking to for a while. Okay. I know that I have a few people on my caseload who are in that situation. Um, and it's a really hard conversation to have, but I'm not going to shy away from it if I'm worried that you're not okay. Right. So you got to have somebody who cares enough about you who's going to tell you if they think you need to consider a move. Right. But you need to choose that person and you need to talk about it beforehand. Okay. You also, and that doesn't have to be a counselor, it could be a family member, it could be a good friend, right? You want to find somebody that you trust who spends enough time with you, either physically or talking to you, and who you're open enough with so that they get a sense of what the real situation is. Okay. And I would say plan ahead sooner rather than later. Okay. It may not be a time for a move now, but you can go and visit some residences. You can meet with your financial advisor. You can get a sense of what you want for your future to look like ahead of time. And if you're on your own, you might want to consider, and it's a really hard bit of advice to give, but you might want to consider moving before you really need to because you're not going to have that care manager. And so you're going to want to move somewhere and build relationships with the staff and the management that are there because you're probably going to be relying on them to provide you the care that you need later on. And you want to have the time when you're still articulate, when you're still capable, where you're still able to tell them what you want and don't want. You want to be able to build that relationship with them so that you can trust that they're going to help you in the way you need to be helped later. Do you have any other suggestions, Ainsley?
I think you covered it all. That was
Okay.
very informative. Thank you, Karin, and thank you to all of you who engage with the content.
All right. Thank you very much.